He didn't say anything else. It was very just like, you know, it might be a blood clot, it could be deadly. And that was it, and he left. And I started panicking, like, he didn't tell me anything more. He didn't tell me, you know, what the chances of it being that are. Just, you know, that's what I think it might be. And pretty much you could die from it. And so my mom came back in the room, and I just started crying. And she's like, what did he tell you? And I was like, it's not good. And she's like, you know, her face just... And she, well, what did he tell you? What did he say to you? And I was like, he said it could be blood clots in my lungs. And, you know, right away, she started crying. I started crying. She's trying to reassure me that, you know, everything's going to be okay. My friend actually couldn't even handle it. She had to leave the room. She was so torn up. And so she left the room. I asked her, can you please get my sister? My sister and my sister-in-law both came in. I didn't care that I only could have 2 people at a time. I wanted everyone in there. You know, they were trying to reassure me, you know, everything's going to be okay, you're going to be fine, you know. They just think that's what it is. They have to tell you what they think it might be. But the way he said it, obviously was very frightening, because he just said it, left it at that, and left. So then around, I'm going to say 11 o'clock, we had a medicine specialist come in to talk to me, to find out a little more, ask a little more questions. She asked me questions like, you know, again, about do I do drugs, do I smoke, do I share needles, anything. They had to test me for HIV, because they said it could be HIV because of the lesions on the inside of my lungs, because they had no idea what it was. They couldn't tell exactly what it was, whether it was blood clots, whether it was lesions, whether it was mucus, whether, you know, anything. It could be a variety of things. So, you know, they have to take every precaution. So, everything came back clear. They did all their tests. Everything came back clear. They, you know, still had no answers. The next day, I had 2 lung specialists come in and speak to me. And the one came and spoke to me, and she said, you know, again, it could be blood clots in your lungs. If that's the case, we'll give you blood thinners. And, you know, again, we have to tell you that it is, you know, severe, that it is what it is. But again, it could be something as simple, you know, as a cold. It could be something as simple as mucus. It could be as simple, you know, it could be anything. It could be bronchitis. It could be, you know, it could be anything. And, so then she left, and then that's when she spoke with and she was actually very nice. She showed me my x-rays, she showed me my CT scan, she was explaining everything and why they think what it is. And because I had, when you have an x-ray or a CT scan, it's normally black and white, and you know, your lungs should be black and a couple white spots here and there. That's the oxygen level in your lungs. I had a bunch of gray spots, and gray is never good. And it was awkward for them. They were very confused of what it was, because it was only at the top of my lungs. So for, you know, say my lungs are here to here, it was only about that much of the top of my lungs, nothing in the bottom of my lungs. So, I mean, it was very different. They did not know what it was. The other lung specialist, he was an older gentleman, and he's been a lung specialist for over 30 years, he said. And he looked at it, he came in, and he told me, no, you know what, I'm about 90% sure it's pneumonia. You have infectious pneumonia, or bacterial pneumonia. What it is I have a bunch of bacteria in my lungs, and which caused me to cough up blood when I had the anesthetics. Because it could have been the anesthetics triggered it and made me, you know, a reaction after. So what it was, he said that I had pneumonia before surgery. I had no symptoms. I still had no symptoms after. You know, I didn't have a fever. I didn't have, you know, I wasn't coughing up anything. Like, I had a little bit of mucus here and there, but it wasn't anything abnormal for me. Like, I'll cough up mucus here and there anyways, normally around this time of year. I'm very good with not getting sick. I rarely get any kind of cold, so normally it's just a little bit of mucus here and there that I cough up, and that's, you know, my cold for me is, you know, a day with mucus, and, you know, that's it. So, you know, it was nothing abnormal. I didn't have any pains, I didn't have any problems breathing, no shortness of breath, nothing. So, you know, it was very unusual, and they, you know, it made it harder for them to know what was going on. So, they actually, that's what he was sure it was, so right away they started putting me on antibiotics for that. I was taking 2 different antibiotics, plus my painkillers, plus other medicines I was on, so, I had a handful of pills that I was taking every day. I was actually in the hospital for, I think, 4 to 5 days, and Monday to Thursday, or Friday, I think it was Thursday evening I got out. Thursday afternoon I got out. So 4 days. So they ended up moving me. They actually had me on quarantine for a while. No one could come in my room without a mask. I couldn't leave my room without a mask. I had a oxygen thing in my room because no doors could be open. It had to be closed, like sealed off, like they had me quarantined. They thought I could be contagious. After the next day, Tuesday, they, said, nope, you're fine. You just need, this is what you have, or we're pretty sure this is what you have, so you're not quarantined anymore. You can go for walks or whatever. They ended up putting me in a different room. I had my own room upstairs in the respiratory unit. And I had my own room, and, the nurses were awesome. Awesome nurses. They were phenomenal. And, it was as good as it could be for being in a hospital for that long, and I got out. I'm doing much better now. I finished my antibiotics yesterday. I have to go for a checkup with my family doctor next week, just to have x-rays done, make sure, it's all cleared up. If not, I have to take some more antibiotics, obviously. Other than that, it ended up turning out pretty well. My chest is healing phenomenal. I had no bruising, actually, until about, I'm gonna say, day 3 or 4 after surgery. I started to get bruising, and then the bruising's almost gone now. So I had bruising for about 3 to 4 days, and it was gone. The right side is actually kind of sore, right under my nipple, but that could be because I'm moving a heck of a lot more now that I'm not in the hospital. I was actually outside playing catch with the dogs here. I wasn't throwing the ball. Don't worry, I'm not throwing or moving my arms ridiculously like that. I was actually kicking the ball, but because I was kicking with my right leg, I'm thinking it might have just used a little muscles here, and that's why it's a little sore. And actually, it's only sore right when I wake up in the morning and right before bed, so I'm pretty sure that's why. It's because at the end of the day, my muscles are ready to relax, and that's when the pain kicks in. Other than that, like I said, it's healing fantastic. I get my sponges off tomorrow, so I'm super pumped to see my chest without tape and sponges, and, I've been taking the binder off for about 10 minutes here and there throughout the day, a couple times a day, just to let some air get at it and not have the binder on, because it is irritating. It's just a medical binder. I can show you what it looks like. Simple as that. I can actually show you what my chest looks like now. I'll show you in a minute. And I'll actually show you pictures leading up to it. So I won't show you my chest yet. I'll show you some pictures of, I think it was the second day after surgery, Tuesday, and then day 4 after surgery, and then another one, and then now. So, and then I'll show you some more pictures of my sponges coming off tomorrow. So I actually won't post this video yet. I will get all the pictures together first for ya, and then that way you can see a little progression there.